The data shows that remdesivir has a clear-cut, significant positive effect in diminishing the time to recovery. Whenever you have clear-cut evidence that a drug works, you have an ethical obligation to immediately let the people who are in the placebo group know so that they could have access.
That was Dr. Anthony Fauci at the White House yesterday touting positive studies from Gilead Sciences' drug Remdesivir. It's being tested to treat COVID-19 patients, and Gilead is now promising to ramp up production, donate more than 1.5 million doses to help fight the virus. Joining us right now is family physician Jennifer Caudle. Dr. Caudle, it's great to see you this morning. Thanks so much for being here. Your reaction to what you heard from Dr. Fauci and the strength of Remdesivir.
Yeah, Maria, I have to say I'm optimistic. This is exciting news in the sense that, we haven't had, good news regarding coronavirus thus far. We haven't had news about a potential treatment, about a potential therapy. The scientist and the doctor in me knows that we have to be cautiously optimistic. We still have to look at the rest of the trial, the rest of the data. There's still a lot more we have to learn. But, this is certainly a good start, and I know it's giving a lot of people hope, and it's actually giving us physicians hope as well.
So tell us what we need to know about it. What's the difference between, for example, remdesivir and hydroxychloroquine? Which one, in your opinion, looks like a better treatment?
Well, so first of all, let's start with your second question, which is that the trials, right? So we always say data. Data is our friend. Really, the only way we will know if something works and if it's safe is if we do studies on it. And what we have with this latest trial with remdesivir is we have pretty decent results. The study showed that 31% of patients, the patients in the study actually had a 31% faster time of recovery, meaning they recovered in 11 days versus 15 days. That was statistically significant. That is good news, okay? So anyway, to answer that question, based on the data, remdesivir looks awesome. What remdesivir is, let's get right to that. First of all, it is not a vaccine. I want people to know that. It's not a vaccine. This is a potential treatment. Now, this is a treatment that was given in the study to people who were very sick. They were hospitalized patients. So this right now is not for people with mild disease. It's not for people that may be at home. And it was given in the IV or intravenous form, not a pill form. This is an antiviral medication, a medication that works against viruses. This works differently than hydroxychloroquine. They are different medications. And the last thing that I'll say about it is that remdesivir, we've heard this on the horizon for the last few months. This was a medication that was initially tested in Ebola patients, but has also shown some efficacy against MERS and SARS, which are also coronaviruses, kind of like COVID SARS-2, which is what we're talking about here.
Yeah, I read earlier about this antiviral drug, remdesivir, outsmarts the coronavirus because, well, first of all, it's administered intravenously, as you said. It's not a pill, it's intravenous, but it interferes with the way the virus replicates itself. Really good news. We'll keep watching that. Dr. Caudle, always a pleasure. Thank you so much.